All right, good afternoon, everyone. It's great to have you here today. We've got a jam-packed agenda ahead of us, so I'm going to jump in and get started. My name is Jasmine Chan. I'm an Associate Research Fellow at the Global Centre for Preventive Health and Nutrition at Deakin University. And today I'll be steering the ship of this webinar as we hear from 4 excellent speakers from our research team, all exploring the link between quick service restaurants in Australia and our health. I will flick through to the next couple slides. Before we jump into today, I'd like to firstly acknowledge the traditional owners of the lands of which we're all gathering virtually on today. I am on the lands of the Wurundjeri people of the Kulin Nation, and on behalf of all of us, I'd like to pay respect to their elders past, present, emerging, and of course, any Indigenous and Torres Strait Islanders present today. All right. So, bit of housekeeping before we start on. So the webinar today will be fully recorded and it will be shared on the Refresh website afterwards. For today, we've also kept everyone's cameras and microphones off, but we will have a Q&A right at the end. So I'd really encourage you to be thinking of some really excellent questions for our speakers and pop it into the Q&A function within Zoom. At the end of the webinar, we'll also be emailing you a summary of everything that we've spoken about today. We'll be sending you a link to the full report as well. And we've also got a short survey because we'd love to hear how you found the webinar. So we'd appreciate any thoughts you have right at the end. All right, and so onto our agenda, as I mentioned, it's very jam-packed. Today we are launching the Inside Our Quick Service Restaurants Australian 2024 report, and we'll have Professor Gary Sachs from Deakin Uni taking us through those headline findings. After that 20-minute presentation, we're also going to have 3 excellent researchers chatting about different areas around fast food. So Dr. Cindy Needham chatting about access to fast food outlets in our neighbourhoods. We'll have Dr. Adya Gupta chatting about the online food environment, and finally finishing with Dr. Kate Sievert chatting about considerations of fast food beyond just health. And as I mentioned, we'll have a Q&A session right at the end. So any questions you can think of throughout the session, pop it in the chat and we'll aim to address it there. Now, this report that we've put together has been built up by a massive team. So I'd like to thank everyone who's been involved from either conducting the assessments themselves or helping us to prepare the reports. The initiative is led by Professor Gary Sachs. And so he is the co-director of the Global Centre for Preventive Health and Nutrition. He's also a chief investigator with Refresh as well. As I mentioned, he's led this initiative for the past 5 years in Australia. So to take us through what we found in the report, I'll hand the mic over to Gary. All yours.
Thanks, Jasmine, and thanks everyone for coming along to this webinar. Before I get to the actual results of our scorecards of the fast food companies, just some background what led us to this study. I think we all know that we need a comprehensive societal approach to improving our diets, and the food industry clearly has an important role to play as part of efforts to improve our diets. And the fast food sector is a really important one. About 1/3 of Australians' food budgets go to eating out and fast food. And the largest fast food chains are really dominant in our restaurant eating out landscape. So this sector is a critical part of what Australians eat. And so that's why we're focusing this study on what fast food companies are doing in the world of nutrition. The other bit of important context is that the current government policy on nutrition at the moment has a really strong focus on voluntary company action. So there's a range of initiatives around nutrition that all rely on companies taking action. The Healthy Food Partnership sets targets for nutrition. Then there's the the policies that the government has around marketing to kids rely heavily on voluntary action from food companies. There is mandatory kilojoule labeling in most Australian states and territories, although not all. So I guess this focus is looking at, in the context of huge reliance on voluntary initiatives, what are fast food companies doing? And so this study is a follow-up to one we did in about 5 years ago, which like this one looked at the voluntary actions fast food companies are taking around nutrition, and it's part of a series of reports. This is the third one we've launched in 2024. The others focus on supermarkets and food and beverage manufacturers. And the aim of the study, as I've said, is to look at how quick service restaurants or fast food companies are progressing in their nutrition efforts. And so what we did is it was been 12 months of in the making. We collected data on the top 10 fast food chains and what they're doing around nutrition. We invited all the companies to work with us to verify that the information that we'd collected online about them is correct, and add any extra info. We then assessed companies based on a validated tool that was developed by the Global Informers Network, and we gave each company a score out of 100 and have recommendations for each company and for the sector overall. So our methods for the score out of 100 is that we looked at 6 different, we call them domains. I'll go through each one of those through this presentation and just report what best practice is, and then how companies were faring. And then for each domain, we've got a set of recommendations for companies. The indicators and domains were based on global recommendations for what the sector, what best practice is in the sector. Each domain is weighted slightly differently, with the most weight given to product formulation and promotion, and that's based on expert consensus on what's important. Throughout the presentation, I do often refer to healthy or unhealthy foods, so I thought it's just worth touching on our definition there. I think the key is that there are a variety of ways to define what is healthy, what is not, and various grades, shades of grey. I think the important thing is for companies in this area to base their definition on government recognized evidence-based definitions. The key one in Australia is the dietary guidelines, or the Guide to Healthy Eating. There's also various state-based frameworks for deciding what's healthy and what's not. So for example, here in Victoria, there's the Healthy Choices Guidelines, which apply mostly to settings like school canteens, but it rates foods as kind of green, amber, and red. The Healthy Food Partnership also has some guidelines around various nutrient targets. And so how healthy are fast food menus? I should point out that this study did not do a detailed assessment of the actual nutrition quality of fast food items. The assessment was broader than that, but just as some context, previous studies have looked at that. And for the most part, the fast food chains we look at are dominated by unhealthy items. So if you look from a kilojoule point of view, combination deals often have more than half the average daily requirements, sometimes up to 90% of kilojoule recommended kilojoule content comes from just one meal. When we've looked at children's meals, kind of there's various ways of classifying it, but you get above 80% of children's meals being unhealthy. So for the most part, these chains are dominated by unhealthy meals. I'll also point out that in looking at fast food, there are obviously other considerations from a public health point of view and an environmental sustainability point of view beyond health. And Kate will touch on some of those in her talk later in the webinar. But just to point out that this assessment that I'm speaking on focused on nutrition. And so here's the kind of headline results. So on average, quick service restaurants in Australia are scoring just 36 out of 100. And so if you look at how they fared, there is quite a bit of variation by chain. And so some of the chains have improved their performance since the last time that we did this assessment 5 years ago. And some chains are still not doing much around nutrition, at least not publicly declaring that. I should note that so 6 of the 10 companies agreed to work with us in understanding what their policies and practices were, which is much better engagement than we had last time around, where only 2 of the companies did so. So I think even in that, the willingness to talk about it there has been some improvement. Here we're just at a high level showing how scores have changed since 2018. In almost every area, there is some improvement. And I think what's also important to note is in each chain, there is some variation amongst the companies in each of those domains, which to me shows that there's plenty of room, there is room for improvement across the board. So how this presentation will be structured, I'll go through each domain. I'll talk about what the indicators were and discuss how companies are going and some recommendations. So the first domain is corporate strategy, and that really is looking at overall company commitments and strategy around nutrition. So what we were looking for is a commitment to nutrition and health as part of their corporate strategies, reporting against nutrition and health objectives, companies being clear about their governance arrangements around nutrition. And so here we did see quite a bit of variation here, but most companies, I guess, pleasingly, are acknowledging that they have a role to play in being part of the solution for improving the diet of Australians. I guess what's less good is that there often wasn't much information beyond a high-level statement about these companies being committed to action in this area. So about half the companies had some reporting on their nutrition commitments, but it's not always regular reporting. Sometimes it's only at the global level, not the Australian level. And unlike in the food and beverage sector and the supermarkets, we didn't see any companies reporting on their sales of healthy versus unhealthy foods. So a good example that we found from KFC in the UK is that they are planning to set a sales-based target for how much of their sales will be from healthy products. And they also report their governance arrangements around nutrition. And so our recommendations there, as they're up on screen, is for fast food companies, given their important role in our community, to identify nutrition as a focus area and to set clear targets there, to have government endorsed standards for how they define healthy and unhealthy foods, and to tell us about how their governance arrangements around nutrition. The second domain is around product formulation. And so that's looking at what actions, what policies they have around improving their menu and their engagement with the Healthy Food Partnership. So a lot of the chains are taking some action to improve the healthiness of their menu items. But there's very little disclosure of exactly what steps they've taken and reporting of the healthiness of their products at kind of a summary level. So the Healthy Food Partnership sets targets for various food categories around, say, levels of sugar and sodium. 4 of the 10 companies do refer to those targets in some cases. For example, there's targets around bread, the healthiness of bread, so ingredients that fast food companies use as part of developing their menu. The Healthy Food Partnership also has voluntary guidelines around portion size or serving size. None of the companies kind of mentioned that or indicated the extent to which they're using those voluntary guidelines. They also, I should point out, the Healthy Food Partnership doesn't have specific nutrient targets for fast food. Companies do report some efforts there, but the general sense is they're not always very comprehensive, and they don't typically apply across the whole menu. So some leading examples, KFC, again, from the UK, have more, are cited as a leading example here. They've got much more detailed reporting around what they're doing to reformulate their menu. What we'd be looking for is all companies to have really specific targets for how they're going to reduce nutrients of concern, how they're engaging with government initiatives. We'd want to see policies to increase the healthy items on their menu, and to routinely report on how their product portfolio stacks up, and how it's changing over time. So much more detailed targets and reporting is needed here. In the Australian context, Guzman y Gomez have a couple of good examples they highlight about actions they've taken on specific ingredients to reformulate them. And I think that again shows what's possible in the space. The third domain is around nutrition labeling and information. What we're looking for there is, firstly, commitment to implement menu board labeling across the board, so not just in the states where it's mandatory, and also to provide really clear, good nutrition information in all settings, so in-store, online, on food delivery apps. We found, just as some context, that only 6% of the major fast food outlets have kilojoule labeling on their online delivery apps. And Adya will in her talk just touch on the whole food delivery app space in a bit more detail. And only 25% of chains have complete kilojoule labeling on those apps. So we're finding some companies commit to display kilojoule labeling across the board, and some companies are doing it online, but most of them are not doing it on the food delivery apps. Nando's, Subway, and Pizza Hut are strong performers here, whereas others have a bit more to go, a bit more work to do. And from our point of view, this seems pretty simple, just giving their customers just easy to use information just so they can understand what they're ordering. There are some good examples internationally of good practice in this area. Domino's in Germany use the Nutri-Score on their products, so that makes it so it's a nice simple visual for people to understand the healthiness of the products. There's a pizza place chain in New Zealand called Hell Pizza, and they color code their menu based on the risk nutrients in the menu. So I think that's really adding an extra dimension to just having kilojoule labeling there. So what we'd expect is all companies to provide this information in just a really easy to understand way. I'm deliberately going through this quite quickly. Obviously, we do have a full report with much more detail, more detailed examples that if you're interested, you can follow. So the idea of this talk is just a snapshot of the results in each of these domains. The promotion practices domain is a quarter of the overall score, just recognizing the importance of marketing and kids' exposure to marketing. There is an industry self-regulatory code on marketing of unhealthy food to kids that was updated in 2021 and applies to all companies. So all companies, just on the back of the changes to the self-regulatory code, and some of the provisions in that, they got a baseline score for their efforts to reduce marketing to kids. But there's a heap of evidence showing that code is really doing little to protect children from being exposed to unhealthy food and brand advertising, and we know fast foods companies are feature prominently when we look at what ads kids are exposed to. So fast food brands are among the most common advertisers of unhealthy food online. There's just a few examples there. Evidence of kids getting exposed to over 10 ads per hour. Unhealthy fast food companies heavily sponsor sports in Australia. Almost all the major sporting codes have a fast food chain as a major sponsor. And at the community level, some studies we've done have shown over a third of community clubs have unhealthy sponsors. Toys and children's meals are another way that these companies market to kids and target them specifically. And we know there's now really strong evidence that unhealthy food marketing does have an impact on what kids prefer, what they eat, what they ask their parents to buy them. I could go on for ages about the various marketing techniques fast food companies use. I think we're seeing, so that's reflected in the really low scores in this domain, despite the voluntary industry codes being in place. So based on public health best practice, none of the companies really had strong commitments to reduce the exposure of children to unhealthy product and brand advertising, particularly around sports and events popular with children and families. We saw no companies reporting on their compliance with marketing policies. One company, KFC, did disclose that they don't provide toys with their children's meals. So that's cited as a good practice example. And really, so what we're looking for is for companies to really get serious about reducing the exposure of kids to marketing of unhealthy food. So that's really applying across all settings, including sports, including their outdoor advertising in a really comprehensive way, and to report on their compliance with that. In the absence of government, of voluntary company action, as you would know, public health groups really calling for strong government action in that space. 2 more domains to go. This domain is around product accessibility and affordability. It's really to do with the availability of healthier items on the menu and the way they're promoted. And really, evidence shows that fast food companies heavily promote their unhealthiest products. So they promote them in various ways. So through price discounts or bundle deals. We see a lot of evidence of things like $1 frozen Cokes, free chips when you order online, loyalty bonuses that give you free chips. That kind of thing is really prevalent. So we're seeing very little action from companies in promoting their healthy items. So even when companies put healthier items on their menu, that they're not promoting those through price deals and combo deals. We found if you look at the default options that come as part of meal combos, we only found a couple of examples where the healthier option is the default choice when you order a combo meal. Although that's changing, some of the children's in respect to children's meals, we did see 4 companies now have healthier drinks as the default option, and so I guess that paves the way for more companies to follow. So Subway is an example there that only has a healthier side and drink options with their children's meals. So at least like if you're ordering a sandwich at Subway, the sides you get with it are relatively healthy. In the UK, KFC has sugar-free soft drinks as the default option, and they've got rid of full sugar soft drinks from their menu. So at least, I mean, one can argue about the healthiness of sugar-free drinks, but look, it certainly would cut the sugar intake down with them doing that. So the recommendations here are pricing strategies that promote the healthier products on the menu, for price promotions to incentivize healthier selections rather than the unhealthy ones, and for combo meals to have the healthier options as default. The final domain is around disclosure of relationships with external groups. We know there's evidence of food companies trying to influence the policy process, and I think what the public health recommendations are for companies to either not just get involved in politics at all and political lobbying, or at least at the very least to disclose their activities there. So we saw 4 companies say that they don't make any political donations, but what we'd be looking for is for all companies to declare all of their external relationships and to support public health measures. So Domino's disclosed that they don't make political contributions. And there's an example there of Walmart that is really transparent about the grants they give to community groups and their support for research and similar activities. So look, I'm going to wrap up just by summarizing the actions that we're recommending in this report. And again, the full details are available in the full report. So our priority actions that we're recommending for the industry are to set targets for their sales of healthier menu items, to get serious about reducing the exposure of kids to unhealthy food marketing, to have targets, nutrient-based targets for their reformulation efforts, have a whole range of healthier sides and drinks and make those the default options, to use their price promotions and loyalty bonuses and the various other ways they promote various items on their menu to promote their healthier options and limit the incentives for unhealthy items, clear nutrition labeling, and to actively support evidence-based public health policy. When we think about changes since in the last 5 years, as I mentioned, we did have greater engagement from the sector this time around, which I take as a step in the right direction. Companies are now willing to engage with discussions about what they could be doing around nutrition. We've got the example of Domino's there. They scored much worse last time around than they did this time, and their CEO has indicated a much stronger focus on nutrition, which is good to see. And we do have some examples of Nando's and Guzman y Gomez who are at least leading the way in having healthier items and promoting them. But it's clear overall, with a score of 36 out of 100, that the sector is not doing enough around nutrition, and fast food sector is a major part of the Australian food environment. And so it's clear voluntary actions are not going far enough at the moment, and that's why it's clear that stronger government action is needed. So the actions we're calling on government to take are to have strong national legislation to protect children from exposure to marketing of unhealthy products and brands, to have clear formulation targets for the quick service restaurant sector around particular nutrients as well as meal options. And we are recommending that there be mandatory company reporting on the kinds of metrics that we're talking about here, so that companies can be really transparent about what it is that they're doing around nutrition. So look, thank you for your attention on this, and thanks to everyone who's worked on the project team. As I say, it's been at least 12 months in the making, this report. And I'd also like to thank the many company representatives who did engage with us as part of this project and gave us the most accurate picture of what they're doing around nutrition. Thank you.
Excellent. Thank you so much, Gary, for sharing the findings of that report. A lot of interesting results and good to see examples of where companies are stepping up and where they could be doing more. So as Gary mentioned, the assessment covered heaps of different areas where fast food practices can impact our community's health. But one thing that is also important is really where fast food chains are setting up shop within our communities. And so for the first of our 3 snapshot presentations, we have Dr. Cindy Needham here today. She's a research fellow at Globe, and she's going to take us through some of her research into exploring access to fast food outlets in Australian neighbourhoods. Now, as she chats, I'd also like to encourage everyone to add your questions into the Q&A as well for Gary and also Cindy. So I'll pass the mic over to Cindy. Thank you.
Thanks, Jasmine, and it's great to be here today to talk to you all about some of the work we're doing in this space and a great report that Gary and the team have presented today. My research program looks at the food retail environment, the healthiness of it, difference in access across different geographical areas, such as rural and remote areas and urban areas, and how it differs across different areas based on their level of advantage and disadvantage. And we look at how this is changing over time. We've also looked at the relationship between the food environment and population health. And today I'm just going to give you a snippet of the findings with a focus on fast food outlets. First of all, just around some research we published in 2020, we did a systematic review of the Australian food environment literature, and we looked at the characteristics of the Australian food environment, variation by geographic area, socioeconomic position, and associations with diet and obesity. Some key findings around fast food environments was that more disadvantaged areas had significantly greater exposure and density of food outlets, which were considered unhealthy in most of those studies. I think there were 5 papers that found that in their research. We found that fast food outlets in a number of papers were more densely located near homes and around schools in low socioeconomic areas, which means that these areas had increased exposure to children and families. In contrast to higher socioeconomic areas, they tended to have better access to supermarkets and fresh food options. And there was one study in particular that highlighted in one of the highest income areas in Melbourne, they had actually no food outlets, no fast food outlets, which was a very interesting finding. From that systematic review, we also found that there was a lack of longitudinal data of understanding how the food environment was changing over time in Australia. So we started on a program of research where we examined how the food environment was changing over time through some projects funded by Vic Health. And we created the Australian Food Environment Monitoring Tool where we present this data. And on this tool, we present different types of food outlets, so 7 different types of outlets, but we also present outlets based on their healthiness, so healthy, less healthy, and unhealthy. And these classifications were developed by a team of public health nutritionists and dietitians, and they looked at the full breadth of what a food retail outlet would sell, and on that basis gave them a score from -10 to +10, and anything that sat in the realm of -4 or below was considered unhealthy, and the majority of fast food outlets sat within that range. And as you can see here, looking at the density of unhealthy outlets per 10,000 population, there was up to 46 unhealthy outlets per 10,000 population and down to 24 outlets per 10,000 population in our outer local government areas. What we saw, there was a trend over time where the density of outlets per 10,000 population was higher across healthy, less healthy, and unhealthy outlets in the inner areas, and the density decreased as we moved further out. Unfortunately, however, the density of fast food outlets stayed the same and was equal density across all local government areas across the between 2008 and 2016. And what we can also see there was a slight increase in the density of fast food outlets over time. This shows here is that potentially that imbalance in fast food density may have resulted in what we can see here, where the trend of decreasing density of outlets as we move further away from the centre actually resulted with our growth areas in Victoria. We're experiencing a lot of urban growth, having a higher ratio of unhealthy outlets to healthy outlets. So we can see there that there's about 7.8 unhealthy outlets to every 1 healthy outlet in the outer areas and the growth area local government areas in Greater Melbourne. And that ratio was consistently imbalanced over the time period of the study. Sorry, there we've jumped ahead a bit. There we go. So what that meant in these growth areas where the Victorian Population Health Survey has noted that there's a higher prevalence of overweight and obesity in these areas, they have to walk past 9 unhealthy outlets before they find 1 healthy outlet. And this was compared to the more inner areas of Greater Melbourne, where they had about 6 unhealthy outlets to every 1 healthy outlet. So there's quite a difference there. We are doing additional research looking at more regional and remote parts of Victoria. This is also available on the tool at the moment. And we can see there that for the density of unhealthy outlets, we've got up to about 10.2 unhealthy outlets per every per 10,000 population, down to sort of 4 outlets per 10,000 population, and the density of healthy outlets was much lower. What we do know as well is that we're seeing some excellent documents coming out that are pushing for us to have a little bit more control about where we allow new unhealthy outlets or fast food outlets start establishing themselves, particularly in areas of urban growth. And there's a lot of demand from community as well for this, in that we've seen lots of campaigns from locals to stop the establishment of fast food outlets, which have unfortunately been unsuccessful to date. What we would like to see from my research and from the government stand going forward is that we have ongoing monitoring of the food retail environment, so we can continue to see how it's changing over time and whether it's getting healthier or less healthy. We need to explore a little bit more about the lived experience of the food environment, so we can really establish what the optimal food retail environment looks like to support good health. We need to do some further research into understanding the influence of diet and purchasing and behaviours and our health, and how the food environment affects this. And we also need some food policies that can support healthier food retail environments. And it would be great to follow in the tracks of the Public Health England, where they have some policies that give local governments the power to monitor the food environment. Thanks very much.
Wonderful. Thank you, Cindy. Some really interesting ways that we can use the tool that you've put together to help us map our neighbourhoods and how healthy they are. All right, well, we are going to travel along to our second snapshot presentation with Dr. Adya Gupta. Adya is a Vic Health Research Fellow at Globe, and we're going to move from our neighbourhoods to the online food environment, and she's going to have a chat about how the online space can shape our health and what we can do to improve it. We also have some excellent questions already in the Q&A, so keep adding those in throughout the presentation. Thanks so much, Adya.
Thanks, Jasmine. Thanks for having me here. So nowadays, digitalization of the food environment has enabled new ways to buy and sell food. And this includes online grocery services, online food delivery services, and meal kits. So today I'll be discussing some of my work that illustrates how online food environments are shaping our health, with a particular focus on the online food delivery services. So a typical online food order and delivery customer journey starts from opening the app to selecting the food, to placing the order and receiving the order, followed by a reorder. The online food delivery sector has experienced unprecedented growth since the pandemic began, and most commonly operating online food delivery services in Australia include Uber Eats, Menulog, and others, with a market size of 1.3 billion in 2023 in Australia. And over 3 billion consumers use online food delivery services in 2024. Online food delivery services expands on the availability and accessibility of food options beyond our local food options. There is evidence that fast food franchises dominate on the online food delivery services and offer a range of discretionary food items. So my work aims to inform and advocate for actions that ensure the online food delivery services offer healthy foods. So to understand online food delivery services from a public health lens, I led some work to investigate the trends in online food delivery service use in 5 countries, namely Australia, Canada, Mexico, UK, and US, from 2018 to 2021. And we found that the overall proportion of the population purchasing meals using online food delivery services increased from 19 to 25%. And the average number of meals purchased using these services nearly doubled for all countries. So we then went on to compare these results to other formats of food purchasing, that is ordering directly from a restaurant or in-person pickup from a restaurant. And we found a decline in the average number of meals purchased across all other sources over time, indicating that online food delivery services may be substituting the conventional forms of purchasing meals outside home. So then we went on to look at how people are making their food purchase decisions on this platform. So for example, what marketing techniques are the users being exposed to on these platforms, and how they are engaging with these techniques in real time. So from the screen recordings of their food purchases, we saw that the most commonly seen food items on the landing page were mostly discretionary, for example, pizzas, chips, etc. And most commonly advertised food outlets on the landing page were largely fast food franchises, such as Pizza Hut's, McDonald's. And the cost of a typical order ranged from 35 to 60 Australian dollars. So in regards to the marketing techniques that consumers were exposed to, we saw a range of techniques. So starting from product type, which was mixed assortment of the products, to placement, which was largely based on the search results order, recommended for you, order again, mix of the products, some promotions like, most rated, most popular, popular near for you, and of course the price promotions, which was largely discounts, 0 delivery fee, time limited deals, and rewards. So these marketing techniques that we saw were for an extent found to be personalized, as the foods on offer were in line with the history of previous orders of the consumers. And we also saw that the consumers engaged with these marketing techniques throughout their purchase, but they were mostly applied at the checkout point to reduce the cost of the final order. Oops, sorry. So with that evidence, it is clear that the online food delivery service use are on a rise, dominated by unhealthy food options. So as Gary mentioned in his presentation, online food delivery service providers, food industry reps, restaurant owners, policymakers, we all have a role to play when it comes to creating a health-enabling online food environment. And here I list a few potential opportunities that could be a good starting point for both the sector and the policymakers. So these include something around restructuring of the digital interface to nudge consumers towards healthier food choices, could be altering the assortment of the food products to display the healthier items as the default items, refocusing on the marketing techniques, so displaying promotions on healthy food items on the menu and offering recommendation on the healthy food swaps, partnering with healthy restaurants to increase the availability of healthy food items and expand current food labeling practices in the online spaces. So all of this could help the sector come across as a health champion in this space. And of course, for the policymakers, this may include providing incentives to the food outlets to improve the range of healthier meals on offer, setting product reformulation targets, having a clear, consistent labeling policies to include both fast food franchises and independent food outlets, and most importantly, taking action to reduce the exposure of the marketing of unhealthy food and brands to children less than 18 years of age. That's it from me. Thank you.
Thanks so much, Adya, and really great to highlight the digital food space now that, I mean, a lot of us can access a whole range of food from the touch of a button. So for our last presentation, we're going to move beyond just talking about health and nutrition, and also think about, well, what other aspects do we need to consider when we're looking at the fast food industry? So I'd like to introduce Dr. Kate Sievert. She's an Alfred Deakin postdoctoral research fellow at Globe, chatting about considerations of the fast food sector beyond just health. Take it away, Kate.
Thanks, Jazz. Yes, hi all. So my name's Kate, and today I'm going to be talking about quick service restaurants and some other important issues in addition to health. So far today, we've chatted a lot about the healthiness of foods offered by quick service restaurants, but there are a range of other factors to consider that extend beyond health. And one factor is the environment. So food production can have significant impacts on our natural resources and climate through things like greenhouse gas emissions, loss of biodiversity, water and land use, as well as pollution. And this is particularly true for animal source foods, which are some of the most environmentally challenging foods to produce. But there's also the conditions in which the animals are raised to think about. And of course, welfare isn't just an issue for non-human animals. Thinking also about farmers and workers and how they're treated and paid throughout the food supply chain is also hugely important. And of course, we should think about the effects of different foods on us, so our culture, social life, and commensality, for example. And so it's important that the fast food industry considers the full range of these considerations in their product offerings because they have a potentially huge impact. Just back to the environment, we've recently conducted a similar analysis to the nutrition assessments, but for the sustainability of Australian quick service restaurants. I just want to note that the bulk of this work was done by an amazing master's student, Francesca Serentino, but she can't be here today. But we found that in comparison to supermarkets and food and beverage manufacturers, Australian quick service restaurants had some of the lowest scores for their sustainability performance, or sorry, their commitments. So of the companies that did have higher scores, they tended to have a public sustainability strategy document in place and at least some commitments to reducing greenhouse gas emissions. But most quick service restaurants had no sustainability strategy at all. And almost all companies had very limited, if any, commitments to reducing water use, reducing intensive animal source foods, or protecting biodiversity. So overall, there is a lot of work to be done for quick service restaurants to be more sustainable. I'll just draw on one example here where gains could be made for both health and sustainability. So most quick service restaurants sell meals that contain meat and or dairy. And so from a health perspective, lean, minimally processed meats like chicken, turkey, and fish are linked to a lower risk of chronic diseases compared to red and processed meats. And these types of meats also tend to have a lower environmental impact, so contributing fewer greenhouse gas emissions and using less resources such as water and land. In Australia, there is a huge deforestation issue associated with cattle production, as some of you might have seen in the news a few weeks ago. But the meal context also matters for health and the environment. So this includes the way the meat is cooked, whether grilled versus fried, and what is eaten alongside it. So a nutrient-dense salad versus ultra-processed or fried foods. And importantly, there are also ethical and sustainable practices regarding where the meat comes from that need attention. So the overall welfare of the animal is just as much a human issue as it is for non-human animals, and the welfare should be considered from birth to death, not just for part of the animal's life. And so there have also been some innovative new products like plant-based imitation meats that have been designed to help reduce some of the environmental and animal welfare impacts of animal source meats. But these products can vary widely in their nutritional profiles, so might not always be the best alternative. So when considering the healthiness and environmental sustainability of meat, it's important to consider the type of meat, how it's served, and where it comes from. So just key messages moving forward. Sustainability strategies are just the start. Reporting on performance is integral. Greenhouse gases aren't the only metric of importance. We need a holistic approach to sustainability. And this includes prioritizing ethical and just engagement in supply chains, ensuring standards for ethical and environmentally sustainable sourcing of meat and dairy, and policies for deforestation-free animal source foods. And we'll be continuing to look at quick service restaurants and their role in society in some upcoming research that I'll be leading. Thank you.
Wonderful. Thank you so much, Kate. And just really interesting how, food systems really links nutrition, sustainability, and all these other social issues when we're thinking about food. Well, we are moving into Q&A. We've got about 10 minutes or so, and we've got a great list of questions already that we'll be asking the speakers. But feel free to keep adding your questions into the Q&A chat. So I've got everyone back on the screen with me today. I'm going to start off with a question, or a couple of questions we have about the countries that we looked at within this study. So Gary, if you could answer what countries or what was the scope of the assessments. And then moving in, a few of the leading policy examples mentioned in this presentation were from the UK. Do you think there are any particular factors that might incentivize stronger action in UK rather than Australia?
Thanks, Jasmine. So this study focused on the Australian chains only. But when we were looking at best practice examples, we looked globally for those examples. And also sometimes most of the chains are multinational chains. And so we did take into account their global policies that would affect the Australian setting. I'll also point out that a similar assessment using the same tool has been done in about 8 countries. And those are available on the Informus website. Some of them are a few years old now. And as for policy examples, I think we're seeing more action in the UK, definitely because there's increasing government interest in regulating food environments in the UK. I think, but also there's civil society, much stronger civil society pressure. There's a group called Share Action in the UK who are extremely active in the food system, pushing for companies to take much stronger action on nutrition, and I think that is driving company behaviour. Cindy, I don't know if you want to touch on some of the rules in the UK around density of fast food outlets.
Yeah, the Public Health England launched in 2020 using the planning system to promote healthy weight environments guidance and supplementary planning document, which is a fantastic tool that local governments can use. They now have some power around where hot food takeaways or new hot food takeaways are being located. And the guidance particularly talks about limiting new hot food takeaways around schools, but also in areas where there's a high prevalence of overweight and obesity or disadvantage. And I think that's a really good step in the right direction. And there's some research by Matthew Keeble, who has published recently and said that it's been really effective and they're seeing a decrease in new hot food takeaway restaurants.
Excellent. All right. Well, our next question is specifically around how fast food restaurants share their information about how healthy their products are. So in Australia, we've got the kilojoule labelling on the menus. And so the question here is about the focus on kilojoules in that, and around kind of the framing of the focus on the nutrients, whether or not there's kind of any thinking about how that might impact people who might be experiencing food eating disorders, or kind of having that focus on weight stigma as well. Gary, if you wanted to take that on, and then we can maybe move into Adya.
Yeah, thanks. It's an important question. I think kilojoule labeling has its limitations for sure. It's not a holistic measure, and I think we're definitely flagging that a more overarching assessment of how healthy a product is would probably be preferable. But there is overall some good evidence that kilojoule labeling at a population level has some positive effects, including on reformulation as well as on what people buy. I'm not aware of specific research into disordered eating, but that's an interesting one that we can pick up later. Thanks.
Excellent. Adya, I don't know if you had any reflections within the online space and putting kilojoule labeling on those food delivery platforms.
Sure, thanks, Jasmine. And I totally agree with Gary that there is a strong population level evidence to suggest that it has population level benefits. And given when you think about the online food environments, it's very new and still in its infancy in terms of understanding its public health impact. So just think about, where do we start our actions? It's good to start somewhere where we know there is some positive impact. So clear and consistent labeling policies are a good place to start off with. But I do agree that there could be more research around understanding more of its impact in the online space. Thank you.
Excellent. All right, I've got a question here for Kate around the reason there is a lack of commitments on the other aspects of environmental sustainability reporting, apart from those greenhouse gas emissions. So if companies make a commitment, they need to be able to measure progress towards it. Do you think the lack of commitments for these other areas are partly due to it just being a lot more difficult to assess, or the lack of information on the impact of producing different foods?
Thanks, Jazz, and thanks for that question. I guess there's two questions in there. One is around commitments versus measuring progress, and I completely agree. Commitments are very important and they're the start, but having commitments then, having companies then report progress on those commitments, having them, independently audited is also, a huge step forward in becoming more sustainable. In terms of greenhouse gases versus some of the other dimensions, I think that is partly as companies are becoming more aware of the other elements. I think the government has taken some strong steps in mandatory reporting around greenhouse gas emissions, so that has been the focus for many companies. But certainly I know that many companies are becoming more aware about the importance of biodiversity. I think less so on water. It seems the government also hasn't taken a huge focus on water yet, but hopefully we'll see that in the future. So I think there is that kind of bi-directional relationship of government leading the way and showing that these should be areas of priorities for companies to take, and then going from there, setting commitments and making sure that they're measuring progress on those commitments.
Thanks, Kate. All right, our next question, I'm going to float to every speaker. So if you wanted to give a sentence or so in response. So the question is about, what is the buy-in for these fast food companies to make changes to their menus and practices? And I'll extend it to also being more environmentally sustainable. And so the comment is, much of the customer base for these outlets have not been established for reasons of health. So if they are also wanting to be financially viable, kind of what are the reasons why they should be focusing on health? Someone wants to start us off?
I'm happy to start off. I think it is an excellent question, and obviously these are we do need to consider profitability here for these companies. For me, an important consideration is that I think people go to fast food outlets because they want quick and convenient foods. But what we have at the moment is that these companies have kind of normalized that quick and convenient foods are unhealthy, but it doesn't have to be like that. And so there's some examples we've cited. Nando's, Guzman y Gomez, they're making healthier products available. People go there because they want quick and convenient foods, and they're showing that it can be healthy as well. So I think there is a responsibility on these companies to create products that are healthy, and social norms will change, and the status quo is not working.
I'll just quickly add to that, if I can. Thinking of the future for fast food chains, there is a trend that we're seeing of people being more concerned about their health and wanting to live longer, and potentially that will give them some incentives to improve the healthiness of their food that they're selling, because people will want more food and the demand will hopefully increase over time. Fingers crossed.
Can I just quickly add my comment to that too? So so there is a desire amongst people to make an informed decision, like a food choice decision. So they want to see both healthy and unhealthy options to then make an informed decision. So if they're not able to see more of healthy options, they're basically not able to make a more informed decision. So having both these choices up for the consumers to then take a decision is a great approach. Thank you.
Brilliant. All right, well, we've only got a minute left, but I'll end with a question for all of our speakers today. So the assessments that we've done as part of the report, we've done every 5 years. So if we were all to meet back here in 5 years, what are one or two things that you would like to see happen, whether that's the food companies themselves, the government, or within our society, so that we can work towards healthier food environments? Kate, maybe I can start off with you.
Oh, I have so many wishes.
Just one or two.
All right, I'll just give one. But for me, just in relation to sustainability, I would really like to see a lot more of a holistic approach to sustainability and the environment, not just by the companies, but also by the government. And that includes, the ethical engagement with both, workers, farmers, and animals involved in these supply chains.
Gary?
Look, in 5 years' time, hopefully the government has really strict regulations in place to protect children from exposure to marketing to kids. And so we can hopefully get rid of that domain from these assessments. That'd be great.
All right, Cindy?
I would love to see in 5 years' time that when I do my classifying of the food outlets, that there is more and more and more fast food outlets that we can classify above -4 and coming into the more healthiness category.
And Nadia, take us away.
Yeah, so for me in the online food environment space, I'd love to see not one, but many health champions in the space when it comes to creating a healthy online food platform. Thank you.
Alrighty, so it's 1 o'clock, and so it's time for us to wrap up today. It's been a really excellent discussion, and I would like to thank all of our speakers today, and also the audience as well for coming along. As I mentioned, we'll be emailing out a summary of everything we've chatted today, a link to the final report, and we'd also love to hear your thoughts about how you found this webinar as well. So you see a very short survey pop up on your screen once you exit. Thank you again. Thanks for joining us, and have a great afternoon.